I am Shanmugapriya, working as a lecturer in SNS College of Allied Health Science. So, we are going to continue about the basics of respiratory mechanisms. In this session, we will be seeing about external respiration, gas transport, internal respiration, control of respiration, and age-related physiological changes in respiratory system. So, external respiration, or it is also called as primary gas exchange, which involves oxygen being loaded and carbon dioxide being unloaded from the blood. Internal respiration, it is called as systemic capillary gas exchange, where the oxygen is unloaded and carbon dioxide is loaded into the blood. Gas transport, oxygen is transported in the blood in two ways. Most attaches to hemoglobin molecules inside the RBCs to form oxyhemoglobin. A very small amount of oxygen is carried dissolved in plasma, while carbon dioxide is transported in plasma as bicarbonate ion or smaller amount between 20 to 30% of the transported carbon dioxide, which is carried inside the RBCs bounded to hemoglobin. Control of respiration, we have two regulations, neural and non-neural. So in the first neural regulation, phrenic and intercostal nerves. These two nerves regulate the activity of respiratory muscles and the diaphragm and external intercostals, medulla and pons. Neural centers that control the respiratory rhythm and depth are located mainly in the medulla and pons. The medulla, which sets the basic rhythm of breathing, contains a pacemaker or a self exciting inspiratory center and an expiratory center that inhibits the pacemaker in a rhythmic way. Pons center appears to smooth out the basic rhythm of inspiration and expiration set by the medulla. Eupnea. So the normal respiratory rate is referred to as eupnea, and it is maintained at the rate of 12 to 15 respirations per minute. Hyperpnea. So during exercise, we breathe more vigorously and deeply because the brain centers send more impulses to the respiratory muscles, and this respiration pattern is called as hyperpnea. Non-neural factors influencing respiratory rate and depth. Physical factors, although the medulla's respiratory center set the basic rhythm of breathing, there is no question that physical factors such as talking, coughing, and exercise can modify both the rate and depth of the breathing, as well as increased body temperature, which increases the rate of breathing. Violation, conscious control. Voluntary control of breathing is limited, and the respiratory centers will simply ignore messages from the cortex RVish when the oxygen supply in the blood is getting low or blood pH is falling. Emotional factors. It also modifies the rate and the depth of breathing through reflexes initiated by emotional stimuli acting through centers in the hypothalamus. Chemical factors. The most important factors that modify respiratory rate and depth are chemical. The levels of carbon dioxide and oxygen in the blood, increased levels of carbon dioxide, and decreased blood pH are the most important stimuli, leading to an increase in the rate and depth of breathing, while a decrease in oxygen levels become important stimuli when the levels are dangerously low. Hyperventilation blows off more carbon dioxide and decrease the amount of carbonic acid, which returns blood pH to the normal range when carbon dioxide or other sources of acids begin to accumulate in the blood. Hypoventilation or extremely slow or shallow breathing allows carbon dioxide to accumulate in the blood, brings blood pH back into the normal range when blood starts to become slightly alkaline. So, age related physiological changes in respiratory system. Respiratory efficiency is reduced with age. They are unable to compensate for increased oxygen need and are significantly increasing the amount of air inspired. Therefore, difficulty in breathing is usually common, especially during activities. Respiratory muscles become weaker, so their cough efficiency is reduced and the amount of air left in lungs is increased. Health promotion, teaching, can include smoking cessation, preventing respiratory infections through hand washing, and ensuring up to date influenza and pneumonia vaccinations. Thank you.